why alcohol affects your performance in the bedroom, plus signs you should consider seeing a sex therapist. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to reveal the key to making long-term relationships last. But first, let's take on some viewer questions.
Here we go, Dr. Leah. Our first question. A man says, I am a 38-year-old man. I've noticed a significant decrease in my libido as the years go by. I'm concerned that when I'm 50, I won't have a libido at all. What can I do to make sure this doesn't happen?
Well, first you have to ask yourself what changed. A physical issue could be the root cause. Weight gain, diabetes, high blood pressure, and high cholesterol can all affect your ability to maintain an erection or decrease your sex drive because they can lead to a low energy and even low self-image. If you have a health condition, you may be able to increase your libido with exercise, diet, and medical treatment. Some medications for anxiety and depression can lower your libido in men and in some cases can even delay orgasm. If you feel that this may be what's causing the problem, please speak to your doctor before stopping any medications.
Dr. Leah, how about porn? Too much or too little or what? Does it affect it?
Well, I mean, pornography is a big reason many men have what I call pseudo-libido. That's when a person is still interested in sex, but not in a healthy way. It can lead to unrealistic expectations of body image, confusion about what an intimate encounter is, and even negative sexual behavior. If you think that this may be the cause, seeing a sexual addiction counselor could help.
Anything else it could be, Dr. Leah?
Well, alcohol can be another culprit. Increased use can reduce testosterone levels, which is also why you don't want to drink following a good day in the weight room. Alcohol can also increase the risk of erectile dysfunction and low libido. And while illicit drugs can increase your sex drive in the short run, they can also have significant long-term negative effects on your sexual function. Some can decrease testosterone, cause ED, or change how the brain responds to activities like sex that were once viewed as pleasurable in the past.
So no happy hour after the gym, just keep it the smoothies, protein shakes?
Well, it doesn't affect like soreness or muscular endurance. However, cortisol levels are increased, testosterone, plasma amino acids, and rates of muscle protein synthesis decrease, which indicates that long-term muscular adaptations could be impaired if alcohol consumption during muscle recovery is consistent. However, most of these studies are actually done in men. For a bunch of reasons, a lot of the muscular strength studies are almost always done in men. There's a lot of reason to assume that alcohol also leads to muscle impairment in women.
Okay, so porn, alcohol, what else should they consider?
Are you in a relationship right now? If you are, maybe you're not giving it enough attention. You need to put the same or even more time and effort you put into things like work into your relationship. A lack of emotional connection can cause low libido in both partners. And treating a low libido will probably take more than just using medications. You need to face the fact that there's an issue you need to deal with and seek professional help.
Gotcha, thank you. Our next question, Dr. Leah. A woman asks, how can I protect myself against STIs from female partners, sexually transmitted infections?
Yep, an internal condom is a good way to protect you from STIs. They're actually inserted in your body. They were originally developed for use in the vagina, but the FDA now approved it for anal sex as well. Internal condoms can be inserted for up to 8 hours before having sex, and they have a thick rubber rings to kind of keep them in place. Those rings can also provide extra stimulation. A problem with internal condoms is that many people just don't know where to find them or even how to use them properly.
You know, I thought it was up to date on all types of protection. Are they hard to find or to use? Can you give us any tips, please?
You know, honestly, I've actually never seen them in a store before. They are expensive. You can buy them online. They are expensive. I mean, the last time I saw one was when I was teaching a sex ed course and just trying to teach people what it was. But the reality is there's 2 rings and you just kind of squeeze one ring and shove it up there, and then the other one kind of hangs out the side. So they really can be beneficial for additional protection because it's having more of a skin barrier. Dental dams are another way to protect yourself. These are thin sheets of latex or polyurethane that come in squares or rectangles. A person can hold them against their partner's genitals to block skin-to-skin contact during oral sex. Regular disposable gloves can also be used when a person is using their hand or fingers in or inside their partner.
What STDs can be transmitted between women, for example?
There are a number of STDs that can be transmitted between women. Herpes, genital warts, syphilis, and HPV are transmitted by skin-to-skin contact. Using dental dams or even plastic wrap can reduce the risk. Inserting your finger into a vagina can spread HPV, chlamydia, and gonorrhea. A disposable glove or finger cots can help protect against that exposure. Contact between the mouth, tongue, and anus really runs the risk of exposing you again to herpes, hepatitis, and gut infections. Genital-to-genital contact can spread herpes, HPV, and pubic lice. So you want to protect yourself by either wearing gloves or avoiding contact when any of these sores are present. And not thoroughly cleaning sex toys or sharing them can also expose you to chlamydia and gonorrhea. So you could use a condom over the sex toy or just don't share them.
Dr. Leah, a woman says, after chemotherapy, sex is not the same. How can I go back to the way it used to be? By the way, we're very sorry for what you're going through. Dr. Leah, your answer?
Yeah, going through chemotherapy can be very stressful and certainly affect your sex life. You're probably feeling a range of emotions, anxiety, anger, self-consciousness, depression, and grief, which all affect your sexuality. If you had a surgical removal of your body part, it can also affect your sense of self and body image. Some of the side effects of the treatment can also lower your libido, and chemotherapy can have a permanent effect on your hormones.
So how do these factor into someone's sex life, for example?
Well, the most common sexual change for cancer patients is really loss of desire. For women, vaginal dryness and pain may be a problem, but most are still able to reach orgasm. You may need some time for climax and more stimulation to really get there. Finding the most helpful remedy is going to take some time and patience, but it's definitely doable.
And what is a good remedy, Dr. Leah?
So you want to talk to your doctor about how you're feeling right away. They may be able to offer some treatments that will help, like hormone therapy to boost your sex drive and restore vaginal health, or consider counseling or sexual therapy to just really talk about how you're feeling. And do talk to your partner about how you're feeling too, and also like your worries about what you're going through so that they are able to understand everything. Discuss how to work through it and find new ways to be intimate. What about kissing and caressing and mutual masturbation? Just shake things up by bringing in a sex toy if you haven't done that yet.
Still to come on Sex Talk. Benefits of kissing. Couples therapy. How to start dating again.
Sex has its benefits, but so does kissing. Here are some benefits of this small romantic gesture.
Kissing is not just an expression of love, it's a scientifically proven way to enhance your physical and emotional health. It stimulates the release of endorphins, those feel-good hormones that help reduce stress and boost mood. Because of those endorphins, it can act as a pain reliever, possibly helping to alleviate headaches or period cramps. Kissing may also bolster the immune system by exposing individuals to a variety of germs, potentially helping to build immunity. Perhaps most importantly, kissing plays a vital role in building and strengthening emotional connections. It fosters intimacy, trust, and a sense of security between partners.
A lot of types of physical contact have similar benefits, something to consider the next time you're looking to get closer to your partner. Still to come, how to make long-term relationships last and thrive, plus when to see a sex therapist. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have relationship expert and owner of Buksani Counseling Care, Dr. Rachna Buksani Merpuri. Thank you for being here.
Thank you again for having me.
All right, so we are going to jump right in. What do you think is the biggest key to a happy, healthy marriage?
Oh my gosh, Leah, when you find out, you let me know. No, I'm kidding. So the pillars really, when we talk about a successful relationship, are commitment and trust, right? So that's, I think, key to any relationship. The foundation is built on understanding of your partner's world. So a lot of times when I'm working with couples and we sit to do activities, they don't know a lot about each other. They don't know what is my partner's dreams? How can I help make my partner's dreams come true? They don't talk about the meaningful stuff. So I think having a really strong foundation, having that commitment and trust, and really what research has found is what I just told you about, helping your partner fulfill their dreams. That's probably key to a successful marriage or partnership.
So what if somebody has doubts in their relationship? What advice do you give them to help them navigate through those doubts?
The first thing, self-reflect, right? Where are these doubts coming from? Is this a relationship thing? Is this a me thing? Because obviously as couples, we all come into relationships bringing our own baggage. So it's very important to take a step back and evaluate, is this a me problem? Is this a relationship problem? Once I've figured that out, then using effective communication strategies, and if they need help, of course, approaching a therapist, but taking the help of somebody or studying about those communication strategies and working through those doubts that you have.
So if somebody is having those, how do they know when to call it quits or to keep working?
I think initially I would always suggest, if you haven't tried to save your partnership, at least, give it a shot. Talk to your partner yourself. If there is a conflict situation there, reach out, to a marriage and family therapist. Let that process take place. And of course, if all else fails and if there's still that intense conflict in a relationship, then you might think of parting ways, or you might, consider different options. But first, I would suggest at least try to make the relationship work.
A lot of people are really just intimidated by therapy, and especially couples therapy. Something might come up in front of your partner. What advice would you give to a couple that is thinking about therapy, but they're just a little bit apprehensive?
I really believe therapy provides a safe and non-judgmental space for the couple, right? So it's not the therapist's job to judge. So you're not coming there, because I think that's what intimidates a lot of couples. They think they need to come there in the court of law because, whose side is the therapist going to pick? And it's really not our job to pick sides. It's the only thing that we as couples therapists need to do is to enhance communication between the couples. So when couples understand that and they come in knowing that they're not going to be judged, I think they'll feel less intimidated.
Well, thank you so much for joining us, and we'll be right back with more Sex Talk.
Still ahead on Sex Talk. How does alcohol affect sex? How to start dating again. Do OTC birth control pills work? Signs you may need a sex therapist. Do sex toys desensitize you?
Back here on Sex Talk, let's take some more questions from our viewers.
Beautiful. Our fourth question of the day, Dr. Leah. A woman says, my husband gets in the mood after a glass of wine, but then he has trouble with his erection. It sounds like catch-22, right? Is there anything he can do to perform better with alcohol?
Well, one glass of wine really shouldn't do that, so there might be an underlying cause, or maybe he's just drinking a little more than one glass of wine and you don't know about it. Yeah,
plus she doesn't say how big the glass is, right?
Yeah, if your glass is 25 ounces, that might be a problem.
There you go. Measure your glass, people. So how does alcohol affect sex?
Well, short-term erectile dysfunction can happen after consuming really any type of alcohol. Alcohol depresses the central nervous system and slows down the transmission of information between the brain and the penis, causing a decrease of sensitivity in the penis. Alcohol is dehydrating and can lead to increased levels of the hormone called angiotensin, which actually narrows the blood vessels and limits the blood flow to the penis. Alcohol can also cause a drop in circulating levels of testosterone, which leads to a decrease in nitric oxide production that helps relax the blood flow in the penis. But again, I have never seen an instance where this really happens after only one glass.
So this gets me thinking, is there a relationship between alcohol and erectile dysfunction?
Well, many studies have found that men who drink 1 or 2 glasses of alcohol a day may actually have a lowered risk of erectile dysfunction. Remember, alcohol is a vasodilator. Many other studies have shown a significant relationship between regular consumption of alcohol and ED. And that's not counting what chronically consuming large amounts of alcohol can do to your body, like damaging your nerves, raising the risk of cardiovascular disease, and damaging blood vessels.
Dr. Lee, before I go on to ask you about wine, you mentioned a vasodilator. What is that? Did I pronounce that right?
So if you're dilating the blood vessels, it's becoming larger, allowing more blood flow.
Okay, beautiful, thank you. Is there anything to counter the wine?
Yeah, there are some foods that could help with ED. If he's a wine drinker, maybe you suggest he switches to only red. That does have some antioxidants, and some research suggests that it could possibly boost testosterone levels because it blocks an enzyme in the body that attaches to the molecules to testosterone and then sends a message to the kidneys to excrete it. However, most of the research indicates that any alcohol is bad for you, so don't load up on the red wine. The World Health Organization warns that no amount of alcohol is safe, and Canadian guidelines actually just recently dropped their weekly recommendations to 1 to 2 per week.
And in France, they increased it by 5 per week. Anyway.
Exactly. I mean, I think we're all guilty of it. Just now that I have all of this research, it just makes it less exciting. Like that vodka soda, I'm like, yeah, this is just poison.
Exactly. It's an antioxidant at least. At least it got some benefit.
The antioxidant thing is really overrated.
Really?
It really is. It's various vitamins that it's really more of a marketing ploy.
Yeah.
I mean, antioxidants do great things, but there's much healthier ways to get it than drinking alcohol.
Oh, you just killed my buzz. All right, here we go.
It's just something we tell ourselves to make us feel better.
There you go. Dr. Leah, our next question. A man wants to know, is pregnancy possible with pre-ejaculation?
While the chances are low, it is possible. Pre-ejaculate is the fluid that a man releases before climax and comes right before the semen, which has the live sperm and what causes a woman to become pregnant. It is the main reason why the withdrawal method of birth control doesn't really work well.
Okay, so why don't you walk us through how it's possible then?
Well, the pre-ejaculation fluid doesn't naturally contain any sperm. It is possible for sperm to leak into the fluid from a previous encounter. Sperm can also linger in the urethra after ejaculation and mix with that fluid if sex continues.
So how much sperm could there be really?
Well, that is just way too hard of a question to answer, right?
Maybe it just takes one, right? But
right. I mean, that's going to depend on so many things. How much sperm was there in the previous ejaculate? Even if you're urinating and flushing it out. How long was the previous ejaculate? Like, how many hours was that before you're then engaging in the sex? So,
okay. How about studies? Any studies show anything? Or?
Yeah, so studies have found that mobile sperm can be anywhere from 17 to 30% of participants. Peeing before sex, like I said, might flush over that leftover sperm, but I wouldn't really depend on that. So even though pregnancy is most likely to occur when a woman is ovulating, sperm, remember, can last up to 5 days inside her body, so it's possible it could still be there when she isn't ovulating. So chances of becoming pregnant from pre-ejaculation may be slim, but it can occur, and some research estimates that about 20% of people who use the withdrawal method become pregnant. So if you and your partner have had unprotected sex, you may want to consider getting the morning after pill, but remember, it only works if it's taken 72 hours after sex.
That's an eye-opener for all of us. That's great. Thank you.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to AskDrLeah.com.
Dating can be hard for anyone, especially if it's been a while. Here are some tips to getting back into the dating scene.
While the thought of starting to date again may be exciting, it's normal to feel nervous and unsure. Start by making sure you're emotionally ready and that you've given yourself time to heal from any past relationships or experiences. Take the time to reflect on your own wants and needs, ensuring you're ready for this new chapter. Build a support system of friends and loved ones who can provide emotional encouragement and advice. When you do start dating, don't rush. Take your time to get to know potential partners. Building a connection takes time, and it's okay to move at your own pace.
And let people know you're interested in dating. Who knows what can happen once people know you're available? Let's take on some more questions.
Here we go, Dr. Leah. A woman wants to know, is there a difference between over-the-counter birth control and prescription birth control?
There is no difference in the makeup of the over-the-counter pill and its prescription counterpart. The over-the-counter pill is called the O pill, and it's identical to the prescription version with a 93% effectiveness rate in preventing pregnancy. The O pill is also similar to the mini pill. It contains only progestin, whereas the combination pill contains both progestin and a synthetic estrogen.
Can anyone take it?
Well, there are some women who shouldn't take progestin birth control because it could be harmful for those who have breast cancer, unexplained vaginal bleeding, hepatitis, or any liver disease. Women should read the warning label before taking the pill or any other drug. Also, if you're more than 3 hours late taking the pill, you need to take the next one as soon as possible and use a condom for the next 2 days. One company is trying to get FDA approval for an over-the-counter combination birth control pill.
A viewer wants to know, what signs should I be on the lookout for that indicate any professional help, such as a sex therapist?
Well, there are signs that you should be aware of if you think you need to seek professional help. If you're experiencing pain or physical difficulty when you have sex, you should start by seeing a medical doctor to make sure you don't have any physical conditions behind what you're experiencing. There are a lot of conditions that can cause pain, like cervical inflammation from an STD, uterine fibroids, and endometriosis. These conditions can not only make it painful, but also difficult to have sex. And even if there's no underlying physical condition, painful sex can be caused by anxiety, vaginismus, which is painful vaginal muscle spasms during intercourse, and can also be caused by just worries about having sex. Also, stress is one of the many psychological causes of erectile dysfunction.
So let's cut to the chase. When would you see a sex therapist?
Well, if you're dealing with any past sexual trauma, you will need to get help getting over it with a sex therapist or a licensed mental health professional, like our guest today. Another time to see a sex therapist or couples counselor would be if you're in a relationship where you and your partner have mismatched sexual desires. Maybe one of you has a much higher libido than the other, or is interested in exploring sexual fantasies or experiences while the other is not. A therapist can help work through incompatible desires and help figure out if the relationship is working or if you need to bring it to a respectful end.
Doctor, what other ways can they help? Like maybe alternative things, or I don't know.
Well, yeah, I mean, a sex therapist can also help if you and your partner are interested in opening up your relationship with other people, or particularly kinky sex. They can help work out the details that allows both partners feel safe and fulfilled and decide if that type of relationship is going to be best for the two of you.
Dr. Lee, our last question of the day. A woman wants to know, will my vibrator desensitize me?
Good news, no. Your vibrator will not desensitize you. As a matter of fact, there's evidence that using a vibrator contributes to positive outcomes such as orgasms and increased lubrication, as well as decreased pain and a greater likelihood of getting gynecological checkups. If you feel some clitoral numbness after using one, it's most likely temporary and should go away within a day. If it doesn't seem to go away, you need to see your gynecologist and rule out any other medical conditions. You also need to evaluate things like stress, mood disorders, substance abuse, because all of these can affect your sexual functioning.
So Dr. Leah, really there's nothing to be worried about, so keep it on, basically?
Yeah, keep on having fun, right? There's no reason to be concerned that you can only orgasm with a vibrator. If you find that you are having trouble orgasming without one, it's not about the vibrator, but your body may be telling you that you might find certain vibrations more stimulating and more conducive to reaching climax. Also, when you're used to orgasming using a specific method, it may be temporarily more difficult to reach an orgasm in other ways. You might try mixing it up, like masturbating your technique in a different way, so that your body becomes used to reaching orgasms with different toys or different fingers. All right, well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.